We have a question from one of our audience. So they saw a movie where someone had a fear of spiders, or and also a fear of they like wore a mask and gloves and they didn't want to touch anything or anything unclean. And the psychiatrist or whoever hypnotized them to try to get rid of that fear. What are your thoughts on that?
Well, there might be a role, and it's a minor role. I think there might be a role in using, self-hypnosis as a helpful technique. But the point of the hypnosis, and I've done some of this in my career. The point of the hypnosis is not to get rid of the fear. It's not to remove the fear. The hypnotic suggestions would have more to do with. So let's think about how you could walk over and stand next to that spider. And you'll feel afraid, you'll notice your breathing changes and so on. And also, you can imagine yourself standing there and letting that proceed and subside. The point of the hypnotic suggestion wouldn't be to get rid of that fear. You forget that you were afraid. You were never afraid. You see that spider as your friend, that kind of stuff. It's more about it's okay to be afraid and you can handle being afraid. I think hypnosis is sometimes useful in that regard. But of course, most people's impressions of hypnosis are I'll go and he'll twist and move the watch back and forth, and then I'll forget all about being afraid. That's again too much, looking to oppose, get rid of, try and undo the fear. It's okay to be afraid, I think is a much more useful point. It's okay to be afraid, and I can work with that rather than I have to prevent any fear from entering my body.
And would you say that's the ultimate, end goal, essentially, for someone who suffers from anxiety disorder or panic disorder, that we know how to deal with the anxiety, not necessarily that it's always that, our fear is going to go away?